Growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everybody, Dr. Steve Rasner here. As I told you last week, I'm going to continue this second section of specifically how to instill a brand of trust that just resonates with all of your patients. That's the word that they tell other people. Oh, you can trust him. They're really, really good. I mean, isn't that the two things you want? They trust you and they have confidence in you. And if you work and commit your culture around those two things, there's no way that you're going to fail. There's no way. Okay. So how do you instill the culture of trust when they finally get to you? Well, for one thing, and I mean this, is that you be on time. Their time, not your time. If I walk into my office after 39 years, I'm not kidding, this is how much of a stickler I am, and I walk in at 5 of 9, and there are patients in the reception room. My first question, because we start at 9, my first question is, why are they in the waiting room? Next is, what is the very first thing they see, feel, and hear? So they're through your front door. Okay, we can't all afford waterfalls in our office, but I would go with the theme, even if it wasn't fancy, of spa calm. So this podcast is not dedicated to redecorating your office, but it is dedicated to helping those of us that can't afford to do everything at one time. So if there's one thing in my reception room, I would have it be the opposite of looking like a motor vehicle with harsh lights and no. If there's one area I would invest some money in, for sure, would be to make my reception room look warm, inviting, plants, perhaps lights dangling from the ceiling, not really bright lit, a refreshment center. I'm just trying to give you the picture. Whoever is the person, a new patient coordinator, I want that person to be able to get up behind the desk, come out, and simply hand them a chart or extend their hand and say, hi, you must be Mrs. Such and Such or Mr. Such and Such. Welcome to the office, with a smile that is sincere. Let me take it further now about the trust and confidence. I'm going to fast forward where I'm in the room now with this new patient. This is what I say. I say to my patient, now remember, I'm trying right now to teach you how to instill an atmosphere of trust. So I've talked about the beginning when they get in there. If they come into your office and they sit there 20 minutes till somebody brings them back, you've already killed the mojo. So that's why I took the time to mention that to you. So now everything else is assumed went just the way I've taught. And I walk into the room and I'll say, listen, and they're often with a significant other at this moment while they're first meeting me. And I sit down and say, look, how'd you guys find me? It's very colloquial conversation. And I say, look, I want to, you could be sitting in a number of places right now, but you're sitting in my office, and I'm very grateful for that. And I want to tell you some of the differences. I'm pretty sure you're going to find this office very different from what you're used to, and I'm very sure you're going to like it. And one of the differences is that I'm not a corporation. And I know that may not sound, why is he telling me that? That's just how I talk to patients. And I say, because dentistry in the last 12 years has become very popular for corporations to buy practices like mine and overtake them. And listen, maybe some of them work, but many of them are places where you won't get the same dentist the next time you come back. And there's often a sense that maybe you're a little more rushed than you were when you were at a private dentist. And lastly, all I can tell you, I'm telling my audience this right now, talking to you guys, is that I've never had more requests for a second opinion on simply the number of cavities diagnosed by another office than I have in the last 10 years. And I am for sure known in my community as probably one of the more expensive offices to go to. So I'm not bragging about that point. I'm just saying if somebody's coming to me for a second opinion, the only reason they could be coming is because they trust me. The other way I build trust is two things. In your treatment planning decisions, and I don't know another way to say this to you, it's just be really, really honest. On your worst day of your worst week of the worst month of the year, it is what it is. So a tooth that really could be treated with a large restoration, a little larger than normal, but it could be treated very nicely with a large restoration. Should be a large restoration, not a core and a crown, because that patient you thought would go for that. You know, listen, I don't know if I'm going to catch a lot of flack for saying that, but I think trust is earned, and I think, you know, you need to really always, you know, the old medical mantra is do no harm, and yeah, I produce some impressive numbers, but I can look at you in the eye right now, or those of you that can hear my voice and can't see me, I have never, ever one time crossed that line. And I'm sure most of my colleagues haven't either. But it can be tempting. You know why? Because we work by ourselves, and it can be intoxicating that your opinion is the right opinion. Very often I'll say to the patient, I'll say this. I'll say, you know, I want you to know that I come into this room with the mindset of solving whatever dental issues you have, if you have any. Now, I haven't looked at them yet. With the most conservative, least invasive approach that will work. Go back to my comprehensive treatment planning podcast. I go over the 5 arenas that I insist that you look at that comprise comprehensive treatment planning. And if you just do that honestly and fairly, there's more than enough work in one of the 5 arenas. I will often say, I'm not kidding, and I did not always do this, but it is a refreshing way for you to present your work. I said, I'll say to patients, if I know this is like getting expensive, you know, if this becomes a thing for you where you just dread every month the monthly payment, then I'm not sure I would tell you to do it. So I'm talking about trust. I'm talking about using the M word, money word, not beating around the bush. I will say to you this. Once they commit to a treatment plan, you can never add cost or charges to that plan. So when you're in there and you make a decision, let me give you an example. Let's say it's an upper lateral incisor. It looks like large decay into the nerve. You do not see a periapical area, and they don't have pain. But man, it looks stone cold in the nerve. Count that as a root canal. Because if they pay you, I don't care if it's $2,500 or it's $25,000. If you're into it 10 days later, 3 weeks later, and number 7 or lateral 10 becomes a root canal, and you have to have them go back into their pocket, you are dead. You just ruined the trust factor. Whether that's right or wrong, it's the way it is. I am 100% convinced of this. I would eat it. Nobody will ever say that to you. I would eat it. I would do it for free before I would charge them a new fee. So you have to be sure. So err on the side of being egregious, or that it's more. Don't, MO and you became an MOD. Oh my God, call it what it is. And if it's not that, you made the biggest friend in the world when you tell them they're getting a check back. Okay, next. Remember, we're talking about trust. We're talking about people coming back to you, developing this big nucleus because they trust you. Have a reliable product, and if you're in the wrong, own it. Something goes wrong. You do a root canal and a crown. It's 9 months later, they break it off at the gingival margin. You don't know why. My own staff tries to encourage me to give prorate it. I think my product should last 5 years. I do. Maybe not a filling, but a root canal crown should last 5 years. And if it has to come out and do an implant, unless I recommended it and they denied it, which I would have written and signed, that they took the chance on the root canal crown. Unless that, I would deduct it or give it back. That's me. Maybe I'm crazy. That's how I do business. If you have a denture, you have no reason that you can't explain it. It cracked in half. They're not getting a repair. They're getting a brand new denture. Whatever it is, I err on the side of the patient if it's a time sequence that I think is unacceptable. And in some cases, I'm not going to talk about fillings or things like this. And I'm talking about a patient, by the way, this is important, that maintain recall 100% of the time. I'm not going to do a free implant on somebody that fell out of treatment for 2 years. It shows back up when I could have maintained peri-implantitis. I'm not talking about that. If you want to have long-term enduring success, I would consider you thinking about exit interviews when you completed treatment. Now, that's not the day you put in a 3-inch bridge. I would say it's a month after. If you can get them to come back, and if you can't get them to come back, do it at the next recall. Hopefully they come back for the next recall. Your whole point is, don't you really want to know the score? In the heat of the battle, when you're meeting the patient, delivering the care, inserting whatever you made for them, don't you want to know really how you did? And not softball questions either. And I would ask them in person unless it was obvious they weren't comfortable answering in person. And you're not going to hit a home run. The last thing I'll tell you is just my own pearl, and that's this. Remember, we're talking about instilling trust and confidence. Confidence comes from your work working. Your work working comes from a lifetime commitment to CE. And so those of you know that are earlier in your learning curve, you can write to me and I can give you my recommended residency for the next 2 to 4 years, really 2 to 10 years, what courses I would take and where. I don't get a dime for that, nor should I. I'm just giving you my honest opinion. You can't take everything. I also mentioned some courses last week. I'm going to re-mention them really quick before I get into it. And that is on June the 28th of 2019 in my Vineland, New Jersey office will be John Suzuki doing a one-day hands-on soft tissue grafting over teeth and or implants. On July 19th and 20th, 2019, in my Vineland, New Jersey office, you will meet Dr. Frank Zastrow, an oral surgeon from Germany that I'm bringing over to teach how to use autogenous bone from the oral cavity to help develop your implant sites. And then lastly, in October of this year, 4th and 5th, is my awesome 2-day atraumatic extraction and site development course in my office in New Jersey, where you get to work live on patients. I mean, implant dentistry and surgical dentistry is its own entire niche itself. And that niche fits perfectly in my blueprint because my blueprint includes a heavy oral sedation practice because you can market it because it distinguishes you so easily from everyone else. That's why I like the oral sedation protocol blueprint. But the last thing I'll tell you is I would tell you every day do one thing for somebody clinically, or certainly several times a week, that has nothing to do with anything except building confidence, relationships, and your name. Give you a small case example. Some of these are softballs. They're so obvious to me, and in some of them, I'm not sure. I'll give you two examples that happened today. A patient came in yesterday. I don't even remember this patient. He came to me. He'd been to me before. He had crown and bridge in his mouth, and he had number 7 broken off at the gingival margin. Number 10. 2 from my European colleagues. And it become painful, and he was there for an extraction, which he paid for. But I couldn't help just intuitively, with crown and bridge in front of his mouth, ask him how things are. And he had told me he just hi, how you been? You know, that kind of question. But I was kind of wondering, I said, did anybody talk to you at any time about tooth replacement in the front? Because I find it a little unusual that you're not having that. I mean, that was from my heart. I mean, it wasn't because I wanted him to say, oh, do an implant. I really was surprised because he came from my associate office. Then this is all he was having done. He didn't look like that guy, if you will. And he proceeded to tell me that he was set and him and his wife were going to travel. And she got cancer and they didn't have insurance. And he goes, this is what I have now. And those of you that are just listening to me, he gave me the 0 sign. And he was retired and he had a nest egg. And it's funny because 5 minutes earlier, I had told him that I'll speak to Michelle and get him a cost on tooth replacement. When we were done, I said, would it be okay if my assistant takes impressions on you? I said, because at the very least, I'm giving you a tooth there. It's not a very sophisticated tooth. I'm not sure if you'll be able to eat with it that great. But it's a tooth. And it'll look fine, at least if you're out. And what's my cost? You know, I'll tell you what my cost is. It's $100 for a flipper type of tooth replacement for now. I don't know if that's just me or if that sounds crazy to some of you. I do it every single day to some degree. From replacing a tooth to putting a tooth back on a denture. I just call it good old-fashioned marketing, goodwill, whatever you want to call it. And if you're starting in the career and you're early on, I wouldn't overdo that part of it, but keep it in your back pocket. Anyway, I hope this helps you today. I'm Dr. Steve Rasner. This is the Lionhearted. And you can reach me at Dr. Rasner at AOL and look up the Rasner Institute. And check out and see if those courses can fit in your schedule. Thanks for joining us. See you next week.